So the Center of Black Maternal Health and Reproductive Justice is the first of its kind in the country. We have the proud distinction of leading the way in addressing maternal health inequities through 6 units: education and training, policy, community engagement, mother lab, research and grants, and epidemiology. The Center for Black Maternal Health is a community-focused, academic-based center that hopes to address and eliminate maternal health inequities as experienced by Black birthing people across the life course. We're in the middle of a Black maternal health crisis. We know that Black women are 3 to 4 times more likely to die than their white counterparts. We know that 80% of maternal deaths are preventable. So when you look at the data, you look at the inequities, we felt like we needed to do something to really elevate this conversation and elevate the mission of the work. The Center for Black Maternal Health and Reproductive Justice was founded based out of the work of the Mother Lab, which is the largest research lab in the country aimed at addressing maternal health inequities through training and development of maternal health scholars.
Mother Lab consists of 35 students across the nation that come from a range of disciplines in various parts of their education, anywhere from undergrad to even postdoc. Some of these individuals, they will go on to be doulas, midwives, OB-GYNs. And so with that research that we focus on, with the research, policy analysis, we're really pouring into them so that wherever they go into the maternal health world, they are able to show up as their full self and give voice to those most in need.
The Center is addressing maternal health inequities through various events such as conferences, community outreach and support, and mainly through the research and bringing awareness through the research. And that research is interdisciplinary research, as well as research that is statistical and quantitative.
When we consider the center's role in addressing inequities within the community, first and foremost, it is our being clear about the historical role of institutional racism in policies and practices relating to the health and welfare of Black women and birthing people. We want to position ourselves to call it out locally and beyond based upon the evidence and data that is available and that we are accruing as well. We will be using both primary and secondary data. We'll be looking at multiple modalities, qualitative and quantitative data, to amplify the experience and outcome of Black birthing people.
As the Maternal and Child Health Policy Unit Lead, I work collaboratively with Dr. Ayo and the other unit leads to identify, track, and monitor the impact of policies and legislation that support Black maternal health, Black birthing people, and address systemic racism. Our goal really is to build and maintain alliances with strategic health policy partners and leaders at the local, state, and federal level. We really want to be a conduit for policymakers to maximize their reach and influence legislation to protect the Black birthing experience. There are a number of policies and legislation that we are actively watching and advocating for. So a couple of examples of this include the Black Maternal Health Omnibus Act of 2021. Another piece of legislation that we are watching, we were really pleased to see Senator Grassley's new proposal to improve maternal and child health services. The passage of this act would provide critical supports to address the growing issue of maternity care deserts, which we know disproportionately impacts Black and brown birthing people in rural America.
For my role at the center as event coordination, I plan major events for the center. So the R1 is basically a 5-year NIH study focused on the integration of maternity safety bundles and the integration of community doulas to see how those integrations can assist in reducing Black maternal health disparities, particularly in the healthcare setting.
My role at the center is I will be an intern at the epidemiology unit, working with Dr. Shrestha, and we will be researching different maternal health topics, including substance abuse, maternal morbidity, and reproductive health. What brought me to the Mother Lab is all of the health disparities that became very apparent during the coronavirus pandemic, where a lot of Black birthing people and people of color were suffering disproportionate rates of maternal morbidities. And I was fortunate enough to be on board of creating this new lab with other students in undergrad, in graduate school, and medical school.
So the vision of the Center for Black Maternal Health and Reproductive Justice is to protect the Black birthing experience by ensuring that all Black birthing people have equitable and respectful processes in maternity care. The mission of the Center for Black Maternal Health is to elevate conversations around inequities and to eliminate them, and to focus on the elimination of racism in the birthing process. We know that Black and brown women are more likely to experience racism and disrespectful maternity care, so we aim to really focus on reducing that through community-focused solutions that look at resiliency and assets.
My hopes and the dreams for this center are that we continually bring awareness about Black and brown moms that face maternity health inequities. My hope is that someday our efforts will be not just bringing awareness, but that awareness will be recognized, but we will be supporting the efforts to continue to close the disparities.